My name is Meir Kryger. I'm currently a professor of medicine at Yale University, and I've been involved in taking care of patients with sleep disorders for about 49 years now. And I went into the sleep field totally by accident, serendipity, when I had a patient that turned out to be the first patient with sleep apnea that was described in detail in North America. And up to then, I wasn't the least bit interested in sleep. I never thought about it. I was heavily involved in pulmonary medicine. And that kind of triggered a lifelong interest that to this day, I can't quelch. I still love the sleep field. I first got involved with the Academy as a result of Bill Dement, who contacted me at one point, very in the early days of the precursor of the Academy. And he put me in charge of an educational program. And in fact, I developed the very first educational products of the precursor of the anatomy. And I remember very vividly, I created a sort of a deck. At that time, there wasn't really a deck because there were no computer programs that ultimately ended up as a set of slides. And when I created the set of slides on sleep apnea, I sent them to some colleagues to look at, and I discovered very quickly that 10% of males are colorblind. And I had to redo the slides so that people who were colorblind, especially men, could actually see the content properly. And so that was the first product that the Academy created in terms of education. And then there were a bunch of others that followed after that. So that was my first, I'm going to use the word job related to the Academy. And I can't even tell you how many years ago it was. It was very early on, way before the Academy was called the Academy. Well, initially the purpose was getting together. It was really cross-pollinating the various fields that were involved in patients with sleep disorders. So in the very early days, many of the people who were involved were psychiatrists and psychologists. There were very few pulmonary people. I remember the first sleep meeting I went to, which was in Palo Alto, I think in about 1978 or 79, I can't remember the exact date. I was the only pulmonary person in the room. Everybody else was a psychiatrist or a psychologist. And that's when I first met Bill Dement in person. We had communicated a couple of times. And the first thing that Bill Dement ever said to me, was, "My God, you're just a kid." And the reality was, at that time, I really was just a kid. I was just 2 or 3 years out of fellowship training. And here I was, talking to the father of sleep medicine, who at that time was also sort of a kid, but not exactly. He was at the top of his game at that time when I first met him. Well, initially, the organization, in my mind, was developed for the members and to educate the members. And the first real task that I had as an official, with an official title at the Academy, was Director of Education. And I remember on a car trip back from Banff, where there had been a sleep meeting, I was in the car with Philip Westbrook and Carol Westbrook, and they were both very involved in the Academy at that time. And we decided that we needed to do a course, a sleep course. And that turned out to be the first national sleep medicine course. And we held it in Arizona, and we learned a lot of important lessons with that. And one of the important lessons was make sure that you understand what you're being billed for when you're putting on a course. And that course lost money. And it was surprising that it lost money, but we learned to pay attention to details. And we subsequently moved the course to Leesburg, Virginia, where it ran for a few years. And it was great for me because for me to attend the courses, I was learning a lot. And because I would write to people all over the world to come and give lectures at the course. I got to know a huge number of really important people in the sleep field. And that ultimately, when I started to think about a textbook, which was in the mid-1980s, when I first sort of broached the idea with Tom Roth and Bill Dement, I already knew a lot of people because I had been in contact with a lot of people at that time. So the Academy, in a lot of ways, pollinated sleep medicine in a lot of different ways. So the story about the first textbook in sleep is one that really began in Yosemite. I was in Yosemite giving a talk at the California Thoracic Society at, I think it was called the Ahwahnee Lodge or something, a gorgeous old lodge. And Tom Roth was one of the other speakers. I had never met him before. This would have been maybe 1984 or 85 or something like that. I'd never met him before, and we hit it off. And I had meals with him and his wife, and he had one son at the time who was a little toddler. And we did a lot of walking and hiking. And we talked about the fact that I, from a pulmonary background, knew the pulmonary stuff. But at the time, I really didn't know anything else except the pulmonary stuff. And I thought that this was a good time to have a textbook to bring people together. And as it turned out, I had a site visit to go to Stanford, and I met with Christian Guilleminault, and I broached the topic of a sleep medicine textbook to him, and he said, "Meir, don't bother doing it." He said, "There isn't enough meat to fill a textbook, forget it." And then I immediately went and spoke to Bill Dement. I was sort of disappointed in what Christian had said. And I went to Bill Dement and I broached the idea of a textbook in sleep medicine. And he said something I will never forget. He said, "You can't have a field without a textbook, without a body of knowledge." And that was the spark that kind of lit me into really a task that I did for the next 35 to 40 years. And I really loved doing it because it gave me the opportunity to interact with people from all over the world, all sorts of disciplines. And so for me, it was an honor for me to be able to meet all these people. And I felt it was important that there be a textbook for our growing field. Well, the Academy played an important role. So every year when I would go to meetings, I would seek out people. I would go and listen to them. I would go and get us, when you're listening to someone present their work or an overview of something, you really get a sense of how their mind works. You get a sense of how they're going to write and how they're going to transmit the knowledge that they have. And so a lot of the connections that I made were made at national meetings, at the Academy's national meetings. And so for me, that was like incredibly important because all of the people involved in sleep medicine research and people involved in basic science research and clinical science, they all came. They all came, and initially it was a small group. We could barely fill a room. And later on, there were 6,000 to 10,000 people that used to come to the meetings. But for me, it was a great experience. And I was on the board of the Academy for several years. And it was a wonderful experience because, again, I would have contact with the other board members who are all wonderful people, and they all had something else to offer, and they came from different disciplines: psychiatry, ENT, internal medicine, pulmonary, neurology, you name it. They all came, and they all were attracted by the field. And the Academy was the light that attracted all these moths to this field of sleep medicine. Well, there were a lot of interesting stories, and I'm not going to mention names here, But I could tell you that there were some authors who were very, very tardy in producing their chapters, or didn't produce chapters at all. There was one very famous guy who had promised to write a chapter, and it was getting really late, and the book had to go to bed. And he wrote me at that time. There was no email. You know, when somebody wrote you, they wrote you. And he said he was having an affair, and he was too distracted because of his personal life, and there wasn't going to be a chapter. And in the early days of the book, there was no internet, and people would actually send you chapters that were typed, hand-typed. And it wasn't until the second edition that people actually would send files, initially on diskettes, with the various programs that had come out, WordPerfect and Word. So in the first edition, if I had to ask someone to revise something, you can't imagine how much stress that was, because the whole damn thing had to be retyped and redone and rethought. Pictures were also a big problem. There were no digital files. So all of the artwork, and there was a lot of artwork and a lot of polysomnograms in the book, they all had to come as photographs of actual photographs. And sometimes people would send negatives of photographs that we then had to sort of turn into actual images that could go into the book. And I don't know whether people have looked at the first edition carefully, but there's one figure in the book that's upside down. And nobody has ever pointed that out to me. And so I've always sort of wondered about that. In other words, they just flipped it upside down, and there you go. But those were the big challenges in the very first edition, is that there was no technology that made things easy, although the amount of time that was spent in creating a book was about the same. The last edition, the seventh edition, which came out early in 2022, that was tough because of COVID. And what was tough about it is that all the things that you read about the economy, about supply chain, there was a shortage of paper, of the right kind of paper. There were no printers in the US that could do the high resolution printing that was required, because all the printing before had been done in China, where they had very, very modern printing presses. That was a huge issue. Some of the copy editing work and some of the editorial stuff after all the files were done in India. And during COVID, one of the towns where the publisher was doing a lot of work was shut down because of COVID. And then, the other tragedies that happened is that there were several people that died during the creation of the last edition. Some of them related not necessarily to COVID, but to other things. There were 5 authors that died. Bill Dement died, who was one of the chief editors. And so that last edition was tough. And luckily, we had already worked with Kathy Goldstein, and she, even before this, I needed to make sure that there would be succession going into the future. So Kathy Goldstein has been terrific, and hopefully she will take the leadership, taking the book into the future. So the last edition was tough, and some of the authors, besides COVID and stuff, we had authors who were stuck in California because of wildfires, and they couldn't move, or their homes were under threat. We are living, or we have lived through difficult times, and there were many reasons for all these difficulties. But at the end of the day, the book came out. I was pleased that the book came out. It was a labor of love for me, and I had to get it out. They corrected it in subsequent printings, but you know what? It's one of these things that actually actually every book has errors in it. And only it's like when you're giving a talk and you make a mistake based on what you had rehearsed, you're the only one that knows that you made a mistake. Mm-hmm. And it was the same thing in that book. I'm probably the only one that knows that there are these errors in the book, and people will point them out to me eventually, but that one people have not noticed. But that's life. Oh, it was totally separate, and it was, it was sponsored by the Academy. It eventually was called the National Sleep Medicine Course, and it was totally separate, always held in a different location. And there, a couple of years they were held out west in like desert places where the temperature was like a gazillion degrees. And during breaks, I remember in one of them, people would go swimming. They would go into the swimming pool between lectures. And then the Leesburg, Virginia one was a great location. It was beautiful, and it was idyllic. In other words, the location was great, the facilities were great, and the people and the faculty were great. And I was able to maintain contact with so many friends at that time, some of whom have retired and some of whom have died. That was such a wonderful experience to be able to interact with people like Mark Sanders and Mark Mahowald and people like Chuck Seisler, Mary Karskinen, Sonia Ankoli. I mean, it just goes on and on and on. And what a wonderful opportunity that was. Well, I mean, very early on, the people that affected me the most were actually people who weren't even in the field. So after I finished my fellowship program in pulmonary, there was no sleep fellowship, and that came way later. I got my first job at the University of Manitoba in Canada, and the head, the guy who recruited me, he had no interest in sleep. However, he knew that I was interested in sleep, and he said, "Go ahead and start a sleep lab." And in other words, he had that confidence in me. And so that kind of confidence that you get from mentors, he was actually a mentor of mine when I was a medical student and an internal medicine resident at McGill. He just had confidence in me, and you can't imagine how important that is. And later on, when, around the same time, Christian Guilleminault and I had interacted on hikes. Again, hikes in the mountains. I don't know why mountains keep coming up. It was at Aspen. There was a control of breathing symposium. And Christian was really the first neurologist, although he called himself a psychoneurologist because he had a psychiatric background as well. And he taught me the importance of expanding outside of pulmonary and to embrace the rest of sleep physiology and medicine. And so he had a very profound influence on me. Tom Roth had an incredible influence on me. Again, different background. His background was a psychologist interested in sleep deprivation. Mary Karskinen. I mean, there are a lot of people who I consider are informal mentors who basically informed my life. Mary Karskinen, Stephen Sheldon, Stephen Ferber. These are all people that had a great effect on me, and they may not even know it, some of them. Well, during that time period, there was, I'm going to use the word, a struggle. It was a struggle about whether or not the basic researchers and the clinician should be in one organization. And there was, and this sort of went on for a couple of years where the academy people, the clinically, the clinical people wanted there to be one organization and not two. And the SRS, I got to give them credit. They said, no, we want to be separate. We want to meet with you, which is how the APSS was sort of evolved and kept, and to this day, it's still here. And I think that has worked out beautifully. But in the early years, that was an issue that was very stressful for both organizations. Well, the advantage of maintaining two organizations is that they have two different missions. So the SRS's mission is to foster research, develop young researchers, and to disseminate research data. The American Academy of Sleep Medicine has a different mission, a different focus, and some of it may involve clinical research, but it doesn't really involve basic research. I mean, there are people that do both, so it could be at some point in the future there will be one organization, who knows, once both organizations are comfortable enough to make that kind of thing happen. But right now, things seem to be going fairly well from what I can tell. Well, in the very early days of the organization, it was a matter of solvency. Were there enough funds to even continue operating? And I can remember when we had board meetings, we would go to a hotel somewhere. Usually it was often a flea bag hotel somewhere. And some of the people would actually, if they found pencils, they would steal pencils and bring them back to the Rochester office. It was in Rochester in the early days. And so having enough money was a really big issue. And very often at some of the early board meetings, the treasurer would often tell us about what investments he was doing in order to try to maximize. And we had some pretty savvy, doctors who were also investors, and they actually made a lot of money for us. But there came a point when it was shifted over to sort of a professional firm, and so some of the board meetings they would present, we just bought 100 shares of blah blah or something like that. And so I'm guessing none of that happens anymore, but that was done because any organization goes through phases. It has a birth. It has the very young years where things are expanding. It's adolescence. And I think somewhere now the Academy is sort of at the age of 25 or 30 in terms of where it is. And so we're not like the American Heart Association or some of the other organizations, but I think we're going to get there. I think the main accomplishments have been in fostering the legitimacy of the field of sleep medicine. And I can't overstate how important that is. And they've played a very important role in getting government agencies, insurance companies, and doctors in general to understand that there are tens of millions of people in the US and possibly hundreds of millions of people around the world that have sleep disorders that impact them, their families, and society. And I think that has been the major achievement of the organization. Sleep medicine develops differently in different jurisdictions because of who the payers are. So in Canada, when I was practicing, and I was for many years the only doctor seeing sleep patients for a population of 1.1 million people. So I was seeing everybody, and for a long time, I didn't have enough beds. I couldn't study them all in a timely manner. And so in a Canadian system or a single payer system, the struggles you have is getting whoever is paying, which is usually a provincial health ministry, to understand that a lot of people have this problem, and we need to expand. And their idea of expansion is very different than over here. Having said that, if I studied a patient, I would treat them. There was no pre-authorization required. There was no arguing with insurance companies. The patients got the equipment. Our clinic got payment, and that was that. In the U.S., what has evolved, and it took a long time for it to evolve, and the impetus sort of started in the early 1990s, is that the insurance industry is currently calling the shots in the United States. And the insurance industry requires pre-authorization of everything in sleep medicine for testing, for treatment, sometimes for clinic visits, depending on the fine print of the patient's insurance policy. And that is something that, in my opinion, eventually has to change in the U.S. It's very complicated treating patients in the U.S. compared to Canada and other countries. I'm also aware of how sleep disorders are treated in other countries, and the U.S. has some catching up to do, not in technology, but in access. That is the big problem in the U.S. I've had the honor and the privilege of having contact with the most brilliant minds imaginable through my contact with the American Academy of Sleep Medicine. And I can't, it is so important, it has been so important in my life to be able to say that, that I knew Al Retschoff, that I knew Bill Dement, that I had met Dr. Kleitman and so forth, that I can't, these are people that I met, they were the pioneers, and they changed my life. The AASM is the premier organization of sleep medicine in the US and probably the world. And it's been a complete honor for me to be associated with the Academy.